Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology. Today, welcome everyone in our today's session. Today, we will discuss about absorptions of drug. Absorption is under pharmacokinetics, and the topics is discussed under pharmacokinetics are also distribution, biotransformation and excretion of drugs. So, let us go about the session for absorption of drugs. At first, we have to know what is drug absorptions. It is a process by which a drug enters or reaches into the circulation. It may be systemic circulation or portal circulation or pulmonary circulation from its site of administration across the biological membrane. So, this is called absorptions. And now come to the sites of drug absorptions. Number 1, alimentary tract. From alimentary tract, drug is absorbed from oral cavity, stomach, small intestine and rectum. As most of the drugs are given in oral route, so alimentary tract is the most common site of drug absorptions. Other sites of drug absorptions are muscles and subcutaneous tissue from skin, respiratory tract and eye. Now, come to the process of drug absorptions. We know there are two major processes, that are active process and passive process. In active process, energy is required, carrier is required, and against the concentration gradient, these are the common criteria for active process, and the examples are active transport and endocytosis. The drugs that are commonly absorbed in active transport process are iron, streptomycin, alpha methyl dopa, levodopa. These are the drugs that are commonly absorbed through active transport process. Now, we come with passive process. The common criteria of passive process: no energy is required, carrier may be or may not be required, and along the concentration gradient. So, it is a downhill process, and the example of passive process are simple diffusion, facilitated diffusion, filtration or aqueous diffusion. As most of the drugs are absorbed in simple diffusion process. Some drugs that are absorbed by facilitated diffusions are fat soluble vitamin, water vitamin, fat soluble vitamin, vitamin B12 is absorbed in facilitated diffusion procedure, RBC from RBC and muscle and adipose tissue, glucose is transported, glucose is absorbed by facilitated diffusion. Now, come to the factors of drug absorptions. Factors of drug absorptions, it can be divided into two main or two broad headline. Number 1, factors related to drug itself. Factors related to drug itself, number 1, we can say routes of administration, absorption rate, intramuscular greater than subcutaneous and subcutaneous greater than oral. Number 2, dosage formulation. Liquid drug is more readily absorbed than solid drug. Syrup is more absorbed than capsule, and capsule is more absorbed than tablet. Number 3, more lipid solubility. More lipid solubility, more absorptions of the drug. Number 4, more ionization. More ionization, less absorptions of the drugs. Number 5, increased molecular weight and size. Less absorptions occurs when molecular weight is increased, and vice versa. Number 6, more the concentration of drug. More concentration of drug, more absorption of the drug occurs. Now, come to the factor B, factors related to the absorptive organ or environment. Number 1, pH of the absorptive media. Acidic drug in acidic media and basic drug in basic media, better absorption occurs. Number 2, concentration gradient across the membrane. Increased concentration gradient, more absorptions of drug. Number 3, absorptive surface area. We know more surface area, more absorptions. Stomach, less surface area, less absorption occurs, and in intestine, as the surface area is more, so more absorption occurs in intestine. Blood supply, blood flow to intestine is greater than stomach, thus absorptions from intestine is more than stomach. Gastrointestinal motility is another factor. Excessive movement impair absorptions. In diarrhea, less absorptions of drug occurs as there is more motility of the GIT. In diabetic neuropathy causes gastric stasis and slow drug absorptions. Number 6, presence of another drug or food or chemical substances. Sometimes co-administration of other drugs or food interfere with the process of absorptions, like adrenaline plus lidocaine, vasoconstrictions by adrenaline and decreased absorptions of lidocaine. And vitamin C increase the absorptions of iron, and vitamin D increase the absorptions of calcium. Now come to the point how lipid solubility influences drug absorptions. Increased lipid solubility, decreased ionization and increased absorptions occurs, and decreased lipid solubility, increased ionization and also decreased absorptions. Lipid solubility directly proportionate to absorption procedure. Now, role of pH and pK of the absorptive media in the drug absorptions. In acidic drug in acidic media decrease ionizations, increase lipid solubility, so more absorptions occurs in this procedure, and acidic drug in basic media increased ionization, so decreased lipid solubility and decreased absorptions. Alkaline drug, basic drug, if we give a basic drug in acidic media, increase ionizations, so decrease lipid solubility and decrease absorptions of the drug occurs, and basic drug in basic media decrease ionization, more lipid solubility and increase absorptions of the drug. How is a tablet absorbed after being swallowed? This number 1, disintegration. First, the tablet is disintegrated or broken in small particle. This is called disintegrations. And dissolution, then the drug molecules dissolves with the intestinal fluid. Absorptions, then the drug molecules are absorbed by simple diffusion, facilitated diffusion or active transport. How a tablet, capsule or suspension or syrup absorbs after oral ingestion. Tablet, it goes first in disintegration, then dissolution, and at last absorption is occurs. But in case of capsule, as the drug is in powder form, so no disintegration needed in this procedure, it goes to dissolution and then absorption occurs. Suspension, as the drug is already in dissolved state, no dissolution needed, so here no disintegration and dissolution, the drug directly goes to the absorption procedure. In this scenario, we can see when drugs are given, when the drugs is given in the site from GI tract or from other site of administration, drugs comes to the blood stream, and from blood stream it goes to the site of action or liver or kidney or other tissue, and then metabolism occurs in the liver or in other tissue, and finally the drug is ready for excretion. So this is all about today, and thank you all and welcome for our next session.